All right, everyone. So this morning there was an open letter sent out by a trio of CAQ ministers: Healthcare Minister Christian Dubé, Minister for Relations with the English-speaking Quebecers Eric Girard, and the French language minister Jean-François Roberge, trying to clarify these new directives on the language used in the healthcare system. So the open letter is published. And over at the Montreal Gazette, Aaron Derfel, the health reporter there, took a look at this letter and has already broken down the letter and fact-checked the letter to see how much of what was said this morning by those trio of ministers can actually be believed at this point. A great pleasure to welcome back Aaron Derfel onto the program. Hi, Aaron. Welcome back.
Good morning, Elias.
First things first, before you start writing your fact check, when you read the letter, what went through your mind?
Well, that's why I had to fact check it, because having read it, I immediately realized that the claims were at best dubious. So that's why I decided to actually go over the entire letter, sentence by sentence, to scrutinize it, to check whether the claims were either true, false, misleading, or unverifiable.
And you found a lot of misleading claims. I think that's the word I saw the most, is misleading. And I think a lot of it comes down to this directive. You know, I think some people think the directive is like a memo of one paragraph. No, it's a 31-page, very complex directive. Let's dive into that and why it makes so many of the statements we heard from the government today misleading.
Okay, well, the first thing to point out is the infamous eligibility certificate. You'll recall there's been a problem in the education sector. Students trying to get that eligibility certificate to go to setups like Dawson, and they're now requiring it in the health sector. The letter makes zero reference to this eligibility certificate. So under the directive, if you have been issued it, this would entitle you to continue to receive health services in English only, and even then, it's up to the healthcare institution. It could. It's not required. It's not. It must. It can deliver the services in English to you only. That is, if you have that certificate. And this is the first time, the government has imposed such a condition. So right off the bat, those trio of ministers are talking about no conditions. Well, this is a big condition that's imposed, because prior to its imposition, it didn't exist. You didn't need to produce a certificate. The letter goes on to say that there's no requirement to produce anything. Well, if that's the case, why make an allusion now? Why require the English eligibility certificate? And in any case, that's unverifiable, because the directive only came out on July 18th. We have to see how this plays out in various institutions.
And that's a part of this too, right? There's a bit of wait and see for how it actually plays out. I want to read one sentence from the open letter from the government, and then I want you to tackle it, because I thought this was so eye-opening when I was reading your fact-checking piece. So here's the line from the government. The recent directive published by the Minister of Health and Social Services does not limit the circumstances under which users have the right to receive health and social services in Quebec. Any suggestion to the contrary is false. So they say it's false, and then you turn around and say that their claim is false. And I think you've got the receipts to back it up. Tell us more.
Yeah. Yes. So the first and foremost, after the title page and the table of contents, you get to the various articles of the directive, and it says immediately that health services have to be delivered in French. Now it then says that services can be delivered in languages other than French in exceptional situations, and then it outlines all these emergencies. This is the other thing about the directive. It's so convoluted. There's so many pages. You have to flip back and forth between the pages to try to make sense of it. And you also have to go look at the French Language Charter and the Health and Social Services Act. This is something that, very busy doctors and nurses won't be able to do. So essentially what happens is designed to push the healthcare bureaucracy and all these various institutions into defaulting into French only. And we've seen that this has already been happening. I wrote a story earlier this year about the bilingual McGill University Health Center holding meetings in French only. And you have some board members who wanted to hear what was going on in English, and they had some difficulty. So you're already seeing this move towards only French, even before this decree was issued, and the this convoluted directive just really pushes. It does, for all intents and purposes, restrict and limit the use of English in the healthcare sector.
And I just want to point out on those examples, right? It'd be one thing if they list examples of how you can get healthcare in English, and it's someone coming in, they need blood tests. It's someone coming in just for everyday scenarios. The scenarios that they outline, Aaron, and I think you've got some of those examples, are just so not outrageous, but they happen. They're so things that don't happen every day that for someone reading that, they would assume, oh my goodness, English would only be under extraordinary circumstances, not everyday circumstances.
Exactly. That's the message that's conveyed overwhelmingly. Like a scenario, if an adolescent is in a state of psychosis, in other words, has lost touch with reality and is in a crisis and calls the 811 hotline, it is permissible, according to the directive, for the nurse at the other end of the line to speak in English. Well, thank you very much. It would stand to reason, and it would stand to compassion to respond in the language in which the user is communicating. It would stand to reason. You don't need a directive to tell you this, but this litany of imaginary worst case scenarios. It just conveys unquestionably, the thrust, the message that it's in these situations that you should use English. Not a patient comes in and says, I was feeling a little bit nauseous, or I have a mole on my back, and I'd like you to check it. It doesn't apply to scenarios like that. Although they do say it could happen. It's up to the discretion of the institution. And something that I've looked into as well, you have a number of institutions like the MUHC, like the Youth General, that have this designated bilingual status. Well, now it appears the directive takes precedence over the bilingual status of these institutions. And even a hospital like Santa Cabrini, it used to have a bilingual status on the website of the OQLF, the Language Watchdog Agency. And that status has been dropped. And now Santa Cabrini is listed as a quote-unquote ethno-cultural institution on the website of the Health Ministry, entitling it to translation and interpretation services, not the full range of services, in another language like Italian that used to be available under Article 29.1 of the French Language Charter.
Aaron, listen, I got to wrap, but just quickly here, I'm getting questions on the text line like this. My husband's unilingual Anglophone. He did not grow up in Quebec. He's concerned that the medical reports, for example, an upcoming MRI, will all be in French. When you I'm sure you're getting the same questions. What are you telling people when they ask you a question like that?
That question is the most pertinent that you've asked them all. You're very good questions, because that's where I think it's going to sting and hurt the most. It's when people want certain documents in English only, and that's where that English eligibility certificate will come in handy, because a patient will receive the report in French, and for whatever reason they're traveling, they need it in English, and they're going to ask for it in English, and they might get some pushback from, say, a Francophone institution. And that's where I believe that certificate would come in handy with the patient saying, look, I have this certificate if they can get it, right? And it's impossible to get if you're an adult. but theoretically you'd be able to show it. So this is where I think it could play out, and that's where there are these legitimate concerns, and we'll just have to see how things play out in the future.
Aaron, I got to run. Thanks so much for your time.
My pleasure.
Go check out Aaron Derfel's fact check of the government letter on the Montreal Gazette website.